This episode is going to reveal a truth about the cause of high blood pressure and heart disease that the American Heart Association still won't admit. If you're confused and frustrated because you've followed the guidelines to eat less salt and saturated fat and still ended up sick and overweight, this episode is for you. Maybe eating that way helped lower your cholesterol, but other markers are off. Your triglycerides, glucose, blood pressure, and insulin are high. Your HDL is low, and you have excess weight and little energy. You tried to fix the cholesterol problem by following the low-fat, low-salt, low-calorie recommendations, but it made everything else worse. Sound familiar? You're about to learn what actually causes high blood pressure and heart disease. And spoiler alert, it's not saturated fat or cholesterol. When you ask Dr. Google what causes heart disease, you get a lot of risk factors like high blood pressure, smoking, poor diet, high LDL cholesterol, or inactivity. Not a cause. Risk factors are important, but they are a downstream effect. We need to know what causes these risk factors in the first place, because when you treat the cause, you can prevent the effect of high blood pressure and heart disease. Mainstream advice to prevent heart disease is to eat less saturated fat and cholesterol. The thinking is that this will reduce the quote-unquote bad cholesterol that clogs the arteries, right? Wrong. Just because something is repeated over and over doesn't make it true. I can say 2 + 2 = 5 all day, but it's still not correct. You've likely heard the myth about saturated fat and cholesterol for so long from trusted sources you don't even question if it's true. But what if I told you that high LDL cholesterol does not mean you have an increased risk of heart disease? Although drug companies selling you statins would love you to believe this. Worldwide, sales of statins are running at about $19 billion a year and growing. Let's break down this cover-up, and I do mean cover-up, about saturated fats, cholesterol, and heart disease. The hypothesis that saturated fat caused heart disease emerged in the late 1950s. It's called the diet heart hypothesis. Ansel Keys was the magnanimous physiologist who created it. The evidence supporting this hypothesis consisted primarily of one observational study. According to levels of evidence, an observational study is 3 out of 5. You cannot determine causation with an observational study. The 7 countries study compared the level of saturated fat intake with heart disease outcomes. It involved over 12,000 men in Europe, the US, and Japan. There were several major flaws outlined in an article linked in the description, and I'll cover 2 here. First, the study recorded dietary data in less than 5% of the participants. This is about 500 individuals or fewer than 100 participants per country. So the entire low-fat movement started with a sample of 500 men, and the problems didn't stop there. The second flaw was the non-random selection of data for the study. Keys cherry-picked only the areas that showed a relationship between saturated fat and cardiovascular disease. He ignored the data that didn't fit into his original hypothesis, and any scientist will tell you you're not supposed to ignore the data. Despite the shaky evidence, the diet heart hypothesis became the majority opinion and remains so to this day. Look at the American Heart Association's website. They recommend about 13 grams of saturated fat a day. That's the amount found in 2 tablespoons of heavy cream plus 1 ounce of cheese. They also say decades of sound science has proven it can raise your bad cholesterol and put you at a higher risk for heart disease. But how sound is this science? The most recent review of the literature by the U.S. Dietary Guidelines Advisory Committee in 2020 concluded that there is strong evidence for continuing caps on saturated fat intake to 10% of calories or less, and to replace saturated fat with polyunsaturated fat. A 2021 article called Dietary Saturated Fats in Health: Are the U.S. Guidelines Evidence-Based? Reveals otherwise. One of the lead investigators, Nina Teicholz, wrote the book The Big Fat Surprise. I'll link to her interview for our podcast in the description. It's a fascinating read. Her team revealed the evidence is not strong and was in fact cherry-picked once again. The researchers independently analyzed the same studies used by the advisory committee. They found that 88% of the findings did not support the committee's conclusion on saturated fats and heart disease. 94% of the studies that observed dairy foods showed a higher dairy intake was associated with a lower heart disease risk. So, why did they recommend that we limit saturated fat if 88% of the evidence says otherwise? The committee's conclusion relied on data from a randomized control trial. This data showed eating polyunsaturated fats instead of saturated fats lowered total and LDL cholesterol. And this is 100% true. Replacing butter with canola oil will lower your LDL and total cholesterol. What they don't mention is that lowering total cholesterol and LDL cholesterol do not correlate with a reduced risk of cardiovascular disease. That's where this diet heart hypothesis breaks down. Eating more saturated fat does raise LDL cholesterol, but this rise in LDL cholesterol does not mean a higher risk of a cardiovascular event. LDL particle number, and some would argue size, is what matters for cardiovascular risk, not total cholesterol or LDL cholesterol. In fact, this study showed that those with the lowest LDL cholesterol and highest LDL particle number had the highest risk for cardiovascular events. And this study found similar results that a high LDL-P or particle numbers is what matters for heart disease. We've been trying to lower the wrong thing all along. The 2020 U.S. Dietary Guidelines Advisory Committee did not talk about LDL particle size or number, they just discussed LDL cholesterol. Thanks to people like Nina Teicholz, Dr. Peter Attia, and many more who risked their careers to expose the truth, the diet heart hypothesis is experiencing a slow death. But why are things so slow to change? Because it would make the American Heart Association, among other institutions, look really bad to reverse over 50 years of recommendations to limit saturated fat. They would lose the public's trust in funding. Food companies would have to re-engineer food products and marketing. Big Pharma would lose lots of money. So what does this mean for you? If saturated fat and elevated cholesterol isn't causing heart disease, what is? It's time to shift the conversation to the real cause of heart disease, and that's insulin resistance and inflammation. This is a complete paradigm shift for most people. But understanding this is the root cause completely changes your strategy to prevent heart disease. To get help with preventing or reversing insulin resistance, click below to check out our services. We help streamline the learning process for you. You'll get evidence-based, personalized information that works to lower insulin resistance for long-term weight loss and better health. And be sure to subscribe for more information each week about insulin resistance, weight loss, and disease prevention. To learn 5 ways that insulin resistance causes high blood pressure and heart disease, watch this video next. Then watch this video about the difference between LDL-C and LDL-P related to heart disease risk.